when we received the shocking news that there was a serious outbreak of the COVID virus in nearby New Rochelle. We've been living a mask-wearing, restricted life ever since. This morning, we will mark this anniversary with a presentation of what is happening now regarding the coronavirus containment and issues in our community. I'll now hand the program over to today's chair, Peggy Jackson. Peggy.
Good morning, all, and thank you for joining us. I'm going to do a little quick housekeeping. We're going to have each of the panelists speak for about 10 minutes, and then afterwards, if you would like to ask a question, either raise your hand or leave your comments in the chat, and we will get to all of your questions, hopefully. And without any further ado, let me introduce our three panelists. Dr. Sherlita Amler was appointed Commissioner of the Westchester County Department of Health in 2011. She's a licensed physician, licensed registered nurse, and certified emergency manager with many years of public health experience at the federal, state, and local levels. While County Health Commissioner, she briefly served as acting commissioner in the Department of Community Mental Health and is a past president of the New York State Association of County Health Officers. She has led and supported many successful public health initiatives and has played a significant role in the campaign to reverse the rising death toll from opiate abuse. She established a comprehensive response network across Westchester in response to the Ebola and Zika threats. Previously, as a CDC medical officer, Dr. Amler served as a subject matter expert in disaster mitigation and incident command, in particular hospital surge capacity and consequence management from large-scale events, with particular attention to the unique vulnerabilities of children. Dr. Amler helped launch the Center for Disaster Medicine at the New York Medical College, which places a special focus on the protection of children and other special populations during large-scale community disasters. Our second speaker will be Dr. Nora Mazzone, who is a veteran educator in the Mamaroneck School District. She started as a special education teacher, was an assistant principal at the middle school, pre-K through 12 director of special education, and currently the assistant superintendent for student support services in the district. In her role, she oversees all staff and programs which support students' physical, social, emotional, and academic challenges. She directly supervised special education K through 12, nursing in all schools, guidance, psychologists, social workers, occupational therapy, physical therapy, speech and language. In addition, she's been the COVID-19 coordinator this year, so she has been intricately involved with all aspects of the school district's response to the COVID-19 health crisis. The third speaker is Matthew G. Anderson, who is president and CEO of the Osborn, a continuing care retirement community in Rye, New York. He joined the Osborn in 1998 as the administrator of the Pavilion Skilled Nursing Facility and has advanced over the years to positions of increasing responsibility, including Senior Vice President of Healthcare Operations, Chief Operating Officer, and as of January 2016, President and CEO. With over 28 years of professional experience in healthcare, Mr. Anderson previously worked at Wellesley Healthcare Center in Saratoga Springs, New York, where he served as business manager and subsequently as director of business development. Mr. Anderson is a leading age leadership academic fellow, serves on the Academy's advisory committee, and also has served as coach for leading ages 2010 and 2011 leadership committee. An honorary member of the Rye Rotary, where he was a Paul Harris Fellow. Mr. Anderson is a member of the Greenwich Hospital's Community Advisory Committee and serves as a board member of the Rye Free Reading Room. Mr. Anderson received a bachelor's degree of science in health policy and administration from Penn State University in 1992 and a master's of business administration at SUNY in Albany, 1996. He's also noted to be a model in many of the Osborn's fashion shows over the years. So, Dr. Amler, I'm going to turn it over to you. Thank you.
So, good morning. I think my role this morning is to talk about vaccines. And so currently there are over 12 million New Yorkers that are now eligible for COVID vaccine. And these eligible groups include doctors, nurses, healthcare workers, people who are age 65 and older, people age 16 and older with certain medical comorbidities and underlying conditions, And if you go to the New York State Department of Health website, there's a list of who is currently eligible under phases 1A and 1B, and also a list for the comorbidities and the underlying conditions that make a person eligible. And it's really too long for me to go in detail, but I would encourage people to go and take a look there. The vaccines that are currently available for use are Pfizer, Moderna, and Janssen's Johnson & Johnson. And we'll talk a little bit about the vaccines in just a second. But where are vaccines currently available? Well, in Westchester, there are a number of pharmacies that are receiving weekly shipments of vaccine. Our hospitals are getting vaccine, our federally funded healthcare centers, my local health department has gotten vaccine. In addition, we have a New York State-run site, which is our county center, which has received some really accolades on their performance. And there's a FEMA location now, a New York State FEMA location, which is in Yonkers at the National Guard Armory, 2 Quincy Place in Yonkers, that has recently opened up. So how could a person get a vaccine? Well, you can go to the New York State website and go to the Am I Eligible app to see if you are eligible and to make an appointment, or you can call the New York State COVID-19 vaccine hotline, which is 1-833 New York State 4 VAX. And if you are able to get a vaccine, and I went on this website last night, and there were locations within the state that have appointments available. So it doesn't mean that people might not have to drive, but they constantly are putting up availability of appointments. And so if you go on that website, you will see what locations currently do have appointments available. So if you go through the app and you are eligible, you will receive an email that has a barcode, and that barcode has to be brought with the person for their appointment. And they also need to go in and fill out the New York State COVID vaccine form online. If they can't do that online, they can do that at the vaccine site when they arrive there. And then they need to bring proof of eligibility. So, first of all, some kind of identification that shows who you are and that you're a New York resident. And then if you have a comorbid condition, either a note from your doctor, or you can attest that you have one of these, you can personally attest that you have one of these conditions, or some facilities will accept medical records. So that's basically what someone would need to do to make an appointment. So let's think about, how many people have actually been able to get appointments now that we know that there's vaccine out there. You can actually go onto the New York State COVID vaccine tracker, which I did last night. And as of 3/8, in New York State, persons with at least one dose of vaccine is 3,746,905 people. That it represents 18.8% of our population. And people who have completed their vaccine series, 1,893,801, which represents 9.4% of the population of the state. So what about Westchester? How have we been doing? In Westchester, the number of individuals with one dose, as of, I think, probably Sunday's data, was 207,864, and people who have completed their series, 109,219. So the state has been receiving about 300,000 doses of vaccine a week. However, on week 12, they received over 1 million doses of vaccine. So the vaccine is definitely coming into our state and into our county. And so let's talk a little bit about the types of vaccines that are coming in. So as I said, there's Pfizer, Moderna, and the new Johnson & Johnson. So how are they alike? How are they different? Well, all three of these have their emergency authorization by the FDA. Their emergency use authorization has been granted by the FDA. So they're all approved now for use. The Pfizer and the Moderna both use a messenger RNA, a piece of the RNA that delivers a genetic code so that, and that code is to a portion of the spike protein. So they're not giving you the actual COVID virus. It's not actually used in the delivery of the vaccine, but rather this just tiny piece that codes for the protein that's on the outside that enables it to attach to the cell is provided to our cells. And then our cells they learn to recognize that tiny little piece. And then if they ever see that, if we are exposed to the virus, our antibodies will then attack it and destroy it. The Johnson & Johnson uses a different mechanism. It actually does use an attenuated virus as a kind of vector to get the genetic material into the cells. But it uses an adenovirus, a genetically altered adenovirus that is harmless. And again, what it's doing is trying to teach our cells to recognize a portion of the spike protein so that if our body ever sees it, it will trigger an immune response. So who is eligible for these various types of vaccines? Well, the Pfizer was actually studied in people down to age 16. So anyone 16 and older can receive the Pfizer vaccine. Moderna was studied in individuals. Moderna and Johnson & Johnson were both studied in individuals over 18. So currently there is no vaccine that is approved for anyone younger than 16 years of age. I know that they are in study they're currently studying age 12 to 16, but currently we can't vaccinate anyone under the age of 16. So Pfizer and Moderna both require 2 doses, which I'm sure most people know by now, but the amount of time between those 2 doses varies. So with Pfizer is 21 days apart. So you can get it at any point after 21 days, the second dose, any time after 21 days. But you should not get it closer than 21 days. So that's the caveat, is you can get it longer. The second dose can be given longer than 21 days, but it can't be, you wouldn't want to take it closer. Moderna, it's 28 days. And Johnson & Johnson is a single dose vaccine, which has a lot of advantages for people that have mobility issues or difficulty getting to vaccine sites. So it is a single dose. The efficacy, people always say, well, if it's Johnson & Johnson's 1 dose, it can't work, right? Well, wrong. So the efficacy of these vaccines, Pfizer was found to be about 95% effective after 2 doses. So this is 2 doses, and your full immunity doesn't occur for about 2 weeks after you complete that second dose. So, you get your first dose, don't go out, not wearing a mask and trying to see, are you immune? Because the answer is not fully. So you need to get both vaccines, and you need to wait about 2 weeks to be considered fully immune. And even then, we want you to continue to wear that mask and social distance and just do all the things that you're doing to stay safe. But the efficacy for Pfizer, as I said, is 95%. Moderna was around 94%, so they're pretty much equal. Johnson & Johnson, the studies were done a little bit differently, so it's a little bit more of a challenge to compare. But the efficacy of this product was 85% in preventing serious infection or death. So it is still a very efficacious vaccine. The general effectiveness in the United States was felt to be around 72%. So what are the potential side effects of these vaccines when you get them? It's the same as most other vaccines. So site pain, redness, soreness on your arm where you get it, some fatigue, possible headaches. Some people have muscle pain. Some people will have joint pain. Generally, after the first dose, there's little to any response, and most people only complain of a little redness or soreness on their arm where they got the shot. More common is people complaining that they had symptoms after the second dose, and usually younger people complain a little bit more than older people, and again, it's more around the fatigue, headache, but you can have a fever. Both Pfizer and Moderna have reported rare instances of anaphylaxis. And when I say rare, I mean really, really rare. The Pfizer, it was 6 cases per million doses administered, so very, very rare finding. In Moderna, it was 2 cases per million doses given. Johnson & Johnson has had no reported anaphylaxis as a result of people receiving the vaccine. So that just gives you a little bit of the overlay of, what the differences are between these different vaccines. And I'm sure there's going to be other additional vaccines coming on the market. We'll just have to wait and see. So what are the other issues around this? Currently, as you know, we are seeing variants of the COVID vaccine, meaning it's differences in the vaccine. Differences in the virus. That the concern is, could it impact the effectiveness of the vaccine? So there are variants in the UK, in Brazil, and in South Africa have been the ones that have been in the press the most. And the concern is that these variants make the virus more infectious. However, the vaccines do seem to continue to be effective against these variants. And so at the current time, that's not really a concern, although CDC is certainly watching for these variants, changes in these variants and new variants that may occur. So once you're vaccinated, as I said, people need to continue to wear a mask. We need to continue to social distance because we have to get to herd immunity before this is really going to get us where we need to be. And herd immunity means that 70 to 80% of our population is vaccinated, and we're a long ways from being there. So I don't know if you have any questions about what the health department is doing related to vaccination in Westchester, or if you'd like to move on to the next speaker.
We'll take all the questions at the end. Thank you, and we'll come back to you. Dr. Mazzone?
Sure. I'm actually going to take the opportunity to share my screen so you can see some pictures from our schools as I'm talking. Can you?
Yes.
Mamaroneck Public Schools?
Mm-hmm.
Great. So good morning, everybody. I really do appreciate the opportunity to share the journey of our schools over the past year, but also some of the plans we have as we look towards really a healthier and hopefully brighter future. It's hard to decide. It was hard to decide how to describe the complexity of what's really been one of the most impactful times in our community, inside the schools and outside. When schools closed just a year ago, March 13th, for 2 weeks, we all packed up our bags and we thought, okay, we'll be back in 2 weeks. Everything will go back to completely the way it was. And, we now know that we could not have been more wrong. What we do know is that this health crisis has impacted every adult and child in our school community. People have developed fears, vulnerabilities, health concerns that never occurred to them before. And, some of that will ebb, and when we get to a more normalized environment, which we're actually moving towards, but a lot of it won't. A lot of it will linger, and even some of it will surface for people that have not experienced it, really to date. So our first, the first couple of weeks out, we really scurried. We scurried around trying to acclimate, to try to understand what's happening to us, what's happening to our loved ones. And our goal was really around staying connected to our kids, trying to figure out how to support their social, emotional wellness, to keep their academics going, and just to try to figure out how to switch into this remote environment. When we finally realized that we weren't actually returning to school, we set our sights more on the proactive planning for the reentry in September. But in our efforts, we purchased and distributed an enormous amount of Chromebooks, Wi-Fi hotspots to anybody who really needed them to shift to remote learning. We provided meals to virtually anyone on a daily basis that felt they needed them. Our social workers established a hotline that they manned all summer long, so people could call in and report their own food and housing insecurities, but also express concerns about their neighbors. and our social workers would listen to the calls. They responded to every call. And if we couldn't provide the resources as a district, we referred them to some of our community agencies that we collaborate with. And as Dr. Amler knows, we studied and we learned, the nurses, the administrators, what were these CDC guidelines, and what's the difference between the CDC and the DOH, and what do we need to learn to figure out how to, for the immediate and the foreseeable future, for how to bring our kids back and our adults back and keep them safe. And right away in March 2020, we developed a district-wide crisis team, which I'll speak a little bit more about. But the goal of that team was really to be ready to respond to whatever was happening in our community, because it was clear that our community was in a crisis that we didn't understand. And as we moved towards that proactive planning phase, we really had the Stanford Design Lab, Dr. Shapsbroad in the Stanford Design Lab, to work with us to facilitate our conversations around teaching and learning in this new environment. What were our values? What did we think about potential structures, et cetera? Sorry, I don't know why those notifications are coming up. And that's how we came to develop the hybrid plan that we currently have, which enables every student who wants to come to school for at least half day every day. And I'm really proud of the administrators and the staff, including our nurses and teachers, for what they've been able to do to meet the needs of our community. Just to give you a little picture of our district-wide crisis team, it's composed of administrators, psychologists, social workers, community agencies, Larchmont Mamaroneck Community Counseling, Friends of the Family, the CRC, the Bereavement Center of Westchester, all people that could come together to really share knowledge and share resources. And our initial goal, as I said, was really preparing for what was coming at us. And I think at the onset, one of our rawest moments was our first meeting, where I charged the committee to actually develop a death protocol that could be followed if we were to hear that someone within our community and within our community, our school community, had passed. But more importantly, we shared information, we shared resources, we supported each other and kept a pulse on what was going on in the schools and our community. Because at this point, it wasn't something we could do separately. We needed to realize that community meant both schools and all homes together at that point. Come mid-June, just as we thought we were trying to get a little handle on what was going on, the governor announced that we could provide on-site summer services for some of our students. And, our surrounding districts, the majority of them said, no way, this is crazy. We don't even know what we're dealing with. How are we going to bring kids into school? But Mamaroneck dug in once again, and we worked around the clock, and we were able to bring 90 kids with disabilities back for 6 weeks for a summer program. We had to figure out so much, and those lessons actually served as the foundation for September. So we had read the guidelines, but we hadn't had to figure out how to implement them. How do we train staff when we can't have them in a room? How do we make sure that kids who have disabilities can actually engage in social distancing to keep them, safe? What do we do about the extra furniture in rooms? How should rooms be organized? What about teaching and learning? We're used to being so close and personalized with kids. And what about buses? How are we gonna manage that? And we knew nothing about contact tracing. We knew nothing about how to monitor and report and set up a chain of command so our community would feel that we were keeping kids safe, our staff would feel safe working in the program, and ultimately we could call it a successful summer. And it was. And this is Madeline Lucas at Mamaroneck Avenue School, who actually was the lead nurse that oversaw these summer programs. And we used a lot of our training and information to train our staff in September when they came back. By mid-September, the district had distributed over 2,800 Chromebooks to families in need, 300 hotspots to those that didn't have Wi-Fi. We have to date spent over $3 million on protective equipment and resources to have our kids in school on a daily basis. You might have heard that after the winter holiday, the district actually had surveillance testing, voluntary surveillance testing, which cost us over $70,000. Thank goodness for the generosity of our community. But all those efforts have resulted in 84% of Mamaroneck students being able to come to school every single day, when other districts perhaps only had kids come in 1 or 2 days and then not see their teachers for 4 or 5. And now we're at it again. You might have heard that our superintendent, Robert Chaps, has announced that Mamaroneck will move to full K-12 on-site school attendance for students. So our director of facilities has gone into every classroom to measure how many students can fit in, how can we use our large group spaces, what should gyms be used for, what should cafeterias be used for, how do we start thinking about things like recess? Because in the summer, we weren't even letting kids use playground equipment. We've had to purchase an enormous amount of desks and barriers. Reason being, all our classrooms have had tables, because really the mode of teaching and learning is not that of kids sitting in separate spaces, 6 feet apart. It's kids gathering, it's learning as a social endeavor. And all of that had to be revisioned. The district surveyed all parents in the community, asking them, if we were to open the schools full time, would you send your kids back, or would you still keep them home on remote learning, or want them to be on remote learning because more kids were in school on a daily basis? And just last night, Dr. Shops had parent forums for the elementary and secondary levels, where he started to introduce what this kind of new vision of schooling would look like. Because many people think we're coming back to what we were like before, but that is impossible right now, and we all need to acknowledge that. And our administrators continue to work around the clock to fine-tune the scheduling, layer in support services that we need, and keep kids safe when we talk about eating lunch in school and those kinds of things that we now can't do in a large lunchroom as we did before. Here's a picture actually from Central School of one of the classrooms. You can see the desks spaced out. You can see the barriers around 3 sides of the desk. For some of us, perhaps my age, this doesn't seem so alien. This is far from what a classroom in 2021 would look like pre-pandemic. So just a couple of things that we are focusing on as we move forward. And again, I apologize. I can see that there's the little bit of the notifications that are coming up, but we've been working all along prior to this announcement to open, thinking about how we're going to reopen full school. And people have heard me say this before, recovering is more than just putting everything back in place. People keep talking about, I just want things to be back to normal, to be as they were. That's not where we're going, at least not right now. So the district is working hard to think about different resources and structures and programs that will help us both assess and monitor and support students' physical, academic, and social emotional needs. We're kind of realigning our nursing supports. It's clear that our more diverse schools need more medical guidance, need more responsive nursing supports for parents on a daily basis. And we're thinking about programming for the fall that might better support kids that have been significantly impacted by the health crisis, but also summer in terms of how do we make up for lost time. If you've heard my colleague Annie Ward speak at a recent board meeting, our kids have done very well overall. They've been incredibly resilient, but there's no doubt that they've been impacted, and we need to think about what we can do proactively. I think the last thing that I'd really like to stress is that not all of this has been bad in a strange kind of way. We've learned so much. We've started to conduct teleassessment. We've learned about communicating with parents virtually in a way that makes them more accessible to us. And we've learned so much about the use of technology in classrooms. So when this is finally over, it's not like we're going to throw out the baby with the bathwater. Some of it will stay in place because it's let us see that it's valuable. And in some cases, it can put us really on the cutting edge. And these are just several examples of programs that are already actionable for September. The Homics will have a program that will support students 6, 7, and 8 that will provide kids with extra mental health support as well as academic support during periods of the day outside of special education. We're also looking at bringing in family counseling before and after school, and the idea of a parent academy that will be a resource for parents. And as I mentioned, we're working on summer program for special education students. Many more students will receive services this summer. So phew, it's a lot of information, but it's been a busy, long road. There's another picture of a classroom from Central and more of a collaborative kind of structure. It will mean that kids still get quarantined, but we're going to do our best at every juncture that we can, because in the end, we want our kids in school. They want to be here, and we're going to do our best. Thank you.
Okay, Matt.
Stop. Let me get out of sharing for Matt.
Okay.
Give me a second. There you go.
Matt, are you on mute?
You would think after a year of using Zoom, I would have gotten that by now. So, so my apologies. So, but good morning, everyone. Thank you for this opportunity to speak to you all today. My name is Matthew Anderson. As Peggy said, I have the good fortune of actually being the president and CEO of the Osborn, been around for over 100 years, serving seniors. We have about 430 seniors here on our campus in various levels of care, from independent living to assisted living, to skilled nursing care, memory care. And we also serve individuals off campus. We have about another 150 individuals through our home care program off campus that we serve both in the Westchester area and the Connecticut area. Obviously, serving a senior population during the past year of COVID has not been fun. Although I have to say, we serve the greatest generation ever. These are individuals, when you sit there and you talk to them, they're just like, we've been through. I had a 110-year-old who just got the vaccine. She goes, hey, I've been through the Spanish flu. I've been through this. I can get through of anything. And that's their attitude. They've been through wars. They've been through this. They've been through that. They're just amazing, amazing individuals. And I'm so happy to be able to serve them here. It didn't come without its struggles, though. You know, at the beginning of this pandemic, it was a year ago today that we actually shut down the Osborn to indoor visitation. And again, it was a week before a lot of other places actually physically, decided to start closing down. We kind of saw what was coming and decided it was best to go ahead and shut down now before anything got really, really bad. Things for us, we were good until probably got towards the end of March. In testing, that was the biggest issue at that time. And I think a lot of people have a short-term memory. They want to go ahead and do the old Monday morning quarterback sort of thing and look back. But understand, the testing that was occurring at that time was only occurring within hospitals. And if you're already able to go over and test somebody, it was literally, one result took us literally 9 days to get back. Well, 9 days too long. You've already gone ahead and infected other individuals. So those were the struggles we were dealing with, was having testing that could come back quickly and be able to tell us what was going on in our place. The other thing of all the temperature checking and everything, doing all that, PPE and everything. But again, 40 to 50% of these individuals are asymptomatic that are sitting here walking around. So not only do we have 430 residents that live on our campus, we have between our home care agency, which has 400 people, we have another 425 staff that come from our campus. And where do they come from? They come from all over. And these are the most wonderful people ever. These are people that actually physically came in here in the month of March, serving individuals with COVID entirely during the unknown. They came to work, they put their lives at risk with other people to serve the residents. And when you talk to them and find out the why, they're just like, if their family can't get in here to see them, I'm their family now. And that's what we became. We became virtually everybody's in-house family for the past year for all these individuals. Now, we are blessed here at the Osborn. We live, the residents live here on a 56-acre campus. So they were able to get outdoors. And fortunately, we had a very mild winter this past year. A little colder right now, but we're in a kind of a different spot than we are now versus last year. So we had to kind of rethink, reinvent our entire place at that point in time. So dining obviously had to shut down. How do you serve 430 people on this campus, breakfast, lunch, and dinner? But one of the hallmarks for our residents is that socialization around dining. How do you get it to them? How do you make sure it's still warm? How do you still provide them that choice? My dining program has been phenomenal. We've had our hiccups at different times with different things, but we decided to keep our same menu and be able to produce that and actually shut and move all of that out to each one of the residents on every day. The isolation was difficult. One of the things that's a hallmark of the Osborn, and the thing that I love, is the socialization. It's being around one another. It's having big events in our 200-seat auditorium, bringing in lifelong learning, shows to our stage here at the Osborn, and other types of things. But we had to move that over to our in-house channel. So a lot of our stuff went online to either a computer-based system or to our in-house channel 591, which did all the exercise classes, all the other programming. And then we had the great idea, which was to take entertainers that we've had in the past and actually record them and actually put them up as a special show on a given night. And we'd send something special dining that everybody could enjoy together. So that's how we stayed in touch. There was a lot of mask wearing here on campus. PPE was incredibly expensive. Big thank you to Dr. Amler, George, Latimer, county exec, in helping us source PPE when we couldn't find it. I mean, literally, we were buying from people who you didn't even know at different places, but the county was very big with the state and being able to help us with PPE at that time. So huge thank you to George and Dr. Amler. The other thing was just advice going through this. Again, there was no roadmap, as our medical director said, and everything else. You've got to go based on gut. So between the County Department of Health, us, and others, we were learning as we were going. But we were doing our best with what we had. And it was all of those, it was all that synergy between those different groups that really, really got us through. We learned a lot. I mean, we learned we shouldn't be throwing people on vents right away and throwing this way up. That was a big change. Now we've got all these different treatments that are out there at hospitals, and we're seeing the survivability rate much better. But where are we today as an organization? Well, vaccinations. Again, huge thank you to, Steve Otis, Shelley Mayer, Mayor Josh Cohn, and others, and George, letters written saying we need vaccines. We've got a very vulnerable population here at the Osborn, and we need these vaccines. I am happy to say, as of today, that virtually 100% of our residents are now vaccinated on our campus out of 430 residents. There's just a couple that are still there waiting their 2 weeks out, which will be come next Tuesday. And when we hit next Tuesday, we will be slowly starting to reopen some things. Now, what does that mean? As Dr. Amler said, look, we still need to all wear the masks, right? We still need to practice social distancing. Just because we've gone ahead and we've got the vaccine, again, 95% efficacy with that Pfizer vaccine, there's still that 5%, right? We have seen, in talking to my representatives from across the nation, we have seen people become infected after getting that second dose. So that 95% efficacy doesn't mean that you can't get it. And that's really important. What it means is the survivability rate will be much more. And I just want everybody to be aware of that, okay? Because I think the thought process out there is that if I get this shot, I can't get it. That's wrong. You can still get it. Your survivability is going to be much better. The big thing is testing. So we still test our staff weekly here at the Osborn, our direct care staff in the skilled nursing facility. We test twice a week. I'm happy to say that since these vaccinations have started back on January 4th in our skilled nursing facility, the rate of positive infections detected within our staff has plummeted. It's like every day you wake up, it used to be, okay, who's positive today as a staff member and who's asymptomatic? Who do I have to start contact tracing? Now it's waking up every morning, looking at lab reports and seeing all of these negatives. So Dr. Amler, everybody, thank you. The vaccines are working. And I urge you, and I plead with every one of you out there, please, please get the vaccine. Think about people like people here at the Osborn, in their 90s. These are people, if they get this, it just takes a little bit to push them over the edge in a hospital. It's not, oh, if I get this, I'm going to be fine. Just another antidote. Again, in being able to track and test weekly. About 40 to 50% of the people are asymptomatic. I've seen it. I test weekly. I see it. But those people that did get it, just as an aside, I have a lot of people that caught this that are now on blood pressure medication and other types of things, employees that either aren't able to get back to work or now have long-term implications. So people that are out there that are saying, if I'm getting it, I'm going to be fine. You just don't know. You just don't know. So please think about not only yourself, protecting you, protecting family members. Please think about others that live in senior communities and others who you can inadvertently pass these things on to. Don't know where I'm at with time, Peggy.
Keep going if you want, and if not.
Keep going. So just what does this look like going forward for a senior living community? Well, again, we're going to be able to start opening back up now. We've got well over 85% of our staff vaccinated now as well, which is, I'm so proud of my staff for agreeing to go ahead and get the vaccination. It takes a village, as I say. Within that, we'll see dining start to open up here in the next week when we're the 2 weeks out. We'll do that at 50%. We have augmented our duct system with UVC lighting. We've got, the MERV 13 filters. We're regularly cleaning everything. The Purell, my hands, they're chapped. What can I say? But we're all in that same boat. But we're going to be able to do things now. We've had our gym open to 2 people. Can we open it more? Probably we'll keep it to that space size. I think everything, look at amount of space, look at amount of fresh air you can have in a certain amount of room. But we have small group activities now. We have our pool open. And our residents are really looking forward to having some in-person visitation. Thank you to the CDC for finally getting back out to us with some guidance on that. We were waiting for that guidance, and we're going to proceed cautiously here within the next week. And I think that's just it. With the variants out there, proceed cautiously. There's a lot we still don't know, and we're stepping through this together as a group. So thank you to all, and thank you for this opportunity to go ahead and speak today.
Thank you. Thank you all. Let's open it up to questions. If you have a question, please raise your hand or throw your question into the chat. Sean, do we have any questions?
I'm going to give Matthew a public health degree. He did a wonderful job. Beautiful job, Matthew.
Thank you. Thank you. It's out of love for our residents and all the families that haven't had the opportunity to see them. So it's been quite a year. So, but thank you for all your help and everyone's help.
You're welcome.
So we do have some hands raised. First up is Ann McAndrews.
Hi, good morning. Just want to congratulate you on a job well done. Thank you. No question.
Yeah.
Thank you.
Next up is Anne Lefebvre. Apologies if I'm mispronouncing any names.
Hi, it's Lefebvre, no problem. First, I have to give a shout out to Matt Anderson. I have a family member who is at the Osborn, and he has kept her incredibly safe and given us incredible peace of mind. So I thank you, Matt, and also everyone who supported you that you've called out on the call. Dr. Amler, I actually have a question for you that's a little bit of a sidetrack. Many of us were surprised at the end of 2020 that there was a dispute between United Healthcare and the Montefiore system, which has ended up resulting in many Westchester residents, particularly quite a few here in Larchmont, not having access to primary care physicians anymore. I understand this may have also affected county employees. There's been a pretty aggressive letter writing and outreach campaign to all the public officials, but we can't find anyone to take ownership with us. This is really affecting people's access to care during this really tough period. And it's healthy residents as well as those who need specialists during this period. So Dr. Amler, I wondered whether you might be able to help the county residents who are affected by this.
Well, luckily, we have the county executive as a participant on this call. So, Peggy, I don't know if we can open up to the county executive and maybe he would want to speak on this particular topic.
He's actually got his hand raised.
Oh,
Sean,
correct.
can you switch over to him?
Can you folks hear me?
Yes.
We can't, George.
Yeah, to the questioner, the county and myself particularly has been very aggressive on this issue. I'm sorry you haven't seen the things we've done about it. We have been very critical of United Healthcare in not coming to closure with Montefiore. Montefiore has been able to negotiate, and these are tough negotiations. We don't think that either side is automatically right, but they've been able to close with other healthcare entities. So we have done quite a bit to put pressure on United Healthcare, and from a county employee standpoint, we have the ability to negotiate alternatives to United Healthcare that would deal with the Montefiore system, because we know how important Montefiore is in providing services. And if anyone would like to talk to me offline, I'll give you those details. But it would not be true to say that the calls haven't been heard. The problem is United Healthcare has been resistant to them.
Sean, next question.
I believe it was our county executive had his hand raised next. So
I was just going to compliment the speakers today, and particularly Dr. Sherlita Amler. I'm good friends with Matt, and I'm appreciative of Dr. Mazzone, but I'm a big fan of Dr. Amler. She's been terrific day by day as we go through all of these issues, and she's given us steady, sensible medical advice at every turn. So thank you, Dr. Amler.
My pleasure. And I appreciate everybody who's on this call as well. I mean, all the schools. I mean, you know, I learned more about schools, I have to say, in the last 14 months than I ever thought humanly possible. And the same with our nursing homes and all of our assisted and independent living facilities. And I think Matthew did a beautiful job of explaining why the residents in our nursing homes in Westchester are in good hands. And we have worked so closely together over the last 14 months to ensure that they had the PPE. And he's absolutely correct about the testing. Early on, the only testing that you could get was it had to go to the state health department, who then sent the specimens to CDC, and that took forever. And then ultimately, Wadsworth at the state lab was able to do the specimens. But many times the person actually recovered before we ever got their test results. And so through those early months, it was very difficult to manage a disease when you didn't know someone was infected and potentially spreading it to others for up to 2 weeks after they got their test done. And it was a nightmare to try to manage. But I just want to thank Matthew and his staff for doing such a great job keeping all of their residents safe.
If we don't have any other audience questions, we do have several questions from the Summit group.
there are no other hands raised at this time.
Okay, you want to go ahead?
So there are some questions in the chat.
Do you want to read those out for us, Sean?
Sure. First is from, again, any apologies for mispronunciations of names, from Francis Snedeker. So some institutions are proposing that COVID vaccination be made a condition of employment, especially for nursing homes. What is your perception of the wisdom of this policy in general? It's not directed towards anyone in particular.
So why don't I go ahead and take that one, since it does reference skilled nursing facilities. This was probably one of the most difficult decisions I've ever had to make, working with individuals here at our organization for well over 25 years, knowing many of them personally and having about 800 employees. We made the decision, and at the end, it wasn't a difficult decision, in my opinion. It was what had to be the right decision. We did mandate it as a condition of employment here at the Osborn. The difficulty of that is all of the unknowns, and then just choice, right? You're asking me to go ahead to stay here and employed at the Osborn to take something that's only been emergency authorized. And, as I said to my employees here, we all have a choice. And myself, as the CEO of the Osborn, had to think about the residents that we serve and the people that we serve and their age. And I will tell you that the first day that the residents started receiving their first dose of vaccine, the first question was, well, you can't send a non-vaccinated person into my apartment anymore for housekeeping. You can't do this, you can't do that. Which I understood the question, but I also understood that my employees obviously had a choice as well. But in the end, I had to make the decision for who we serve as an organization. So what we did here is we knew we were coming up to one of our last federal programs. Our acceptance rate at that point in time within certain areas wasn't at levels that I felt was acceptable. I think we were 50 some odd percent coming up to that. And in some of the healthcare areas, unfortunately, we were at about 35%. So in mandating it, obviously now we're well above 85% here on the campus, and the people that are remaining are primarily our per diem staff. But we gave them until April 30th to receive first dose. If they don't receive it by April 30th, first dose, they will go on a mandatory leave, unpaid leave, and then they have another 30 days to do it. And what I've asked all the employees in that is that I respect their decision entirely if they don't want to take it. They just need to understand that the given population that we serve here at the Osborn is a population that's extremely vulnerable. We've seen it. And that I just ask them to respect our decision and be happy to help them to find a different path, if that be it. But again, probably one of the most difficult decisions I've had to make. I've had some employees that I've worked with for 20 years resign over it, which is unfortunate. But I respect their decisions and what they did. So again, very difficult decision, but I understand that COVID is not going away. Okay, this is not something that is going to end come the summer. I hate to say that to everybody. Dr. Amler, if I'm wrong, tell me. It's here to stay. And so we might get through this spring, but what comes next fall? And so on and so forth. So very, very hard decision for us here at the organization, but a decision that, again, we felt that we needed to make given the population that we serve.
And if I could, I would point out that in this country, more than 500,000 people, 500,000 people have died in this country as a result of COVID. And as far as I am aware, no one has died from the vaccine. And there have been millions of people vaccinated in this country. So the risk, in medicine, it's all about risk benefits. The risk is certainly substantially greater to getting COVID than there is any risk from taking the vaccine. So I just would remind people of that. And, I think the major thing we've seen, like I said before, is sore arm, a little bit of headache, fatigue, and a slight fever. But most people are over that in a day, 2 at the most. And that's much preferable to ending up on a ventilator in a hospital, in my opinion, my medical opinion.
We've also had 3 employees that passed away from this as well. So I think our our residents and our staff understood where I was coming from. It was just the difficult decision of, do I want to do this? I think as they saw, and as we've seen this, as more people have received the vaccine, we've seen that other people are saying, okay, it's safe. I can go ahead and get this now. And just to reiterate, we've given over 400 doses with our residents here, and well over probably 500 to 600 doses of our staff. It's got to be way over 600 now, and we have not had, knock on wood, any issues to date.
Okay, next question.
We have a question from Davina O'Reilly directed to Dr. Amler. How important is it to have the desk shields on student desks if the social distance is 3 to 6 feet and mask wearing is still in practice?
Well, it's very important. The state guidance says 6 feet. If you're going to be less than 6 feet, you're required to have barriers. That's the state guidance, and so that's the requirement for schools. But let's just be reminded that although we can vaccinate the teachers, we cannot vaccinate the students. And so, they are interacting with each other in classrooms. So we have to protect them. And currently our only mechanism to protect them from each other is social distancing and barriers and the wearing of masks, hand washing, and, the things that we've done in the past. So until I get a vaccine for children, we're unfortunately going to have to do barriers and social distance and masking around them.
Okay, next question.
Also for Dr. Amler, how will we be getting the vaccines to the homebound adults as well as children?
Well, we can't vaccinate children, as I was just saying, because the vaccine is not approved for children at this time. But interestingly, we're just starting to look at and put our foot in the water as far as vaccinating homebound individuals in Westchester. And so this is the process. We haven't done this before. It's a process that we're working on. We've done some vaccines in just yesterday. In fact, we were in Mount Vernon vaccinating homebound seniors in their in an apartment building in Mount Vernon, and we'll be back at another one today. It's slow. It's a much more tedious process. You get fewer vaccines done. But for these people, it may be the only way that they're able to get the vaccine. And I don't know, George, if you want to comment yourself on that.
I don't know if am I heard here or no?
Yes, you are.
Okay. Yeah, we've gone to the municipal governments to ask them to identify a list of homebound seniors working through their police emergency list and also through the senior recreation programs. Now, homebound may not just be seniors. They could just, people with medical issues. And as they put together that list, I think the biggest issue is now that we have the Johnson & Johnson vaccine available, homebound inoculations were going to be very difficult if we had to do a 2-shot Pfizer or Moderna. But with J&J, and we just got our first batch of it this week, we're hoping to get obviously more. Now we think we can put together a homebound plan, which unfortunately, Sherlita, will be one more headache for you that has risen to every headache up to this point.
Well, I'm sincerely hoping we can get more J&J. We certainly aren't getting any next week, but we're hopeful for the future because the county executive is absolutely correct. It makes this process so much easier to do. I think that until we can get our homebound vaccinated, again, it's by protecting other people that are around them, by vaccinating the people that are around them until we can get to them, that will keep them safe until we can have every homebound person in our county safely vaccinated. So it just speaks to the need for herd immunity in those people that we can get to, who can walk into a vaccination site and easily be vaccinated, because it's going to take time to get to the homebound population. That's not going to happen quickly.
Dr. Amler, if I may jump in quickly, LMC Media actually owns a media van. And if we can be of any assistance, maybe with our EMS on a local level, we'd be happy to help.
Thank you. Appreciate that.
Next question, Sean?
Sure. The We have a question from Theodore Saul. First, for Dr. Amler, is there a plan to vaccinate children? But then also for Dr. Mazzone, once schools are full-time, what is being done at MHS to control the lack of physical distance in the hallways and stairs between, before, and after class? Where will kids eat lunch? Can you explain why you have eliminated the safer hybrid option?
So as I said before, we currently have no vaccines that are approved for children, so we cannot vaccinate children. Hopefully we will soon have a vaccine. What they're working on is age 12 to 16. We'll see what happens with that. But currently I can't vaccinate anyone younger than the age of 16. And the 16 and older would only be if they have, currently they're only eligible if they have some underlying medical condition or comorbidity.
And Dr. Mazzone?
Sure. So I guess, first of all, I would encourage all parents in the community to take advantage of the parent forums that are both the superintendent and the principals are conducting over the next few weeks, because some of what we're doing is still in the planning phases. But there's also things in place that will be continued that we've used successfully in the hybrid plan, especially at the high school. So when you talk about things like traffic patterns, hallways where you can only go one way, so you don't come face to face with other students, traveling outside between Post and Palmer. 11th and 12th graders will be allowed to go to outside for lunch and off campus for lunch. Then the cafeterias and those kinds of things can be more socially distanced. But I think it's fair to say that Principal Klain is still working out a lot of the small details with the assistant principals, because right now they wanted to make sure that the current schedule, which is what we know as the hybrid schedule, could continue to work within bringing kids back full time. And it can. So for our students that cannot participate and must stay on full remote, they'll still be able to stream in and the like. I think the other part of the question is more complex to answer because it involves so many variables. Ultimately, our superintendent made the decision, which many superintendents have made at this point in time, based on the data that was in front of him. What we do know is that the transmission, rates in schools have been incredibly low, and we know that from our own data. It's not to say that staff and students haven't contracted COVID, but when you really look at the contact tracing, there's very little to suggest that it's actually being transmitted within the classrooms and within the hallways. So that, I think, is an important piece of data to look at. Likewise, the transmission rate or the positivity rate, and Dr. Amler can speak about this much better than I can do, or Matt, he did pretty well earlier, has really decreased since, before the holidays. And so that's going in the right direction as well. Add the vaccinations, which our staff, I have to say, have embraced the opportunity to be vaccinated. It's kind of the in a positive sense, the perfect combination. And then there's a compelling factor of being face-to-face with your teacher is not nearly as effective as live streaming into a classroom or only seeing them half of the time. So I don't think, Theo, that completely answers the question, but I do think it represents the most significant variables.
Elaine, how are we doing on time? Do we have time for a few more questions? Okay. Sean, what's next?
Yes, I'm sorry. Yes, you can go ahead.
Sure. Next, we have, what is the efficacy of the 3 vaccines against the variants from the UK, Brazil, and South Africa?
So far it looks like the variants are the vaccines are protective against the variants, I guess is the best way to say it. But CDC is certainly continuing to monitor not only how the vaccine is doing. So if somebody who is vaccinated, they're looking at gets COVID, they're looking at, is the COVID that they have contracted a variant, or what happened that they may have still gone on to get COVID. I mean, were they exposed before their vaccination, or were they exposed shortly after they were vaccinated? But in addition to that, they are looking at just randomly, they look at samples from people who have tested COVID positive to see, is it the standard COVID that we've been dealing with? Is it one of the variants that have been identified, or is it a new variant yet to be identified? And so this is the concern. And this is why we're trying to get everybody vaccinated as quickly as possible, and why CDC has recommended, people not just traveling willy-nilly, still being cautious when they travel, restricting travel if it's not important to do, and wearing masks, social distancing, and doing all the right things, even if you are vaccinated.
Thank you. Next question.
Sure. What about getting vaccine appointments for people who are eligible but are computer illiterate or have no access?
So we have been working with people who have been working with our at-risk populations that are computer literate or don't have transportation, and we are doing pop-up clinics in some of these areas. I mean, we have done pop-up clinics around the county to try to get certain pockets done where we know that there are major problems. But it is an issue, and it is something that we are continuing to work on, and we're aware that it's a problem. I mean, it would be lovely if everybody had internet access and everybody was computer literate. But I think most especially our senior programs have been trying to, to work with our senior community, a lot of whom, are not computer literate, don't have computers, and really don't know how to make an appointment.
Okay.
Excuse me.
I think our last question, Sean.
Sure. What is the protocol if a student is found to have had contact with someone with COVID?
Well, they would be, once the case is identified, case investigators reach out to the case, try to figure out where they might have gotten the virus from and who they might have given it to. And anyone who's identified as a contact to a known case would be placed in quarantine. The case goes into isolation, which means that they are asked not to be around other people for 10 days. And anyone that they've exposed, the same thing is true. So a child who was identified or an adult who was identified would not be allowed to go to school, would not be allowed to participate in in-person education for 10 days or go anywhere else for that matter of fact.
I'll just add from the school's perspective, if I may, that if it's an in-school exposure, we have a pretty detailed contact tracing procedure we go through as well. We interview the teacher. Every teacher has a seating plan that shows where kids were. We ask them about what kinds of activities or learning activities were going on in class to determine if there was movement. And if the student falls within what are the guidelines of direct exposure, then we actually report both the contacts and the positive case to the DOH, and then they follow through with the procedure that Dr. Amler has just described.
And I would remind people that, if you were exposed yesterday, don't run out and get tested today, because it does take a while for the virus to have sufficient numbers within your body to show up. And luckily, we're not in the days where it takes 2 weeks to get a result. I mean, you can get a rapid test result now in 15 minutes. You can get most standard PCRs done in a couple hours. And so it's less, since the number of cases is down. You no longer see the long lines outside the testing centers, and you can pretty much walk in and get a test when you want it. We would suggest waiting 5 days from the date of exposure if you're going to test. We don't really suggest people need to test unless they're symptomatic, but they do have to maintain the isolation and for the positive cases and the quarantine for those that are exposed. That's the most important thing. Don't expose other people, whether you feel bad or not, because you could still have COVID. Just don't expose anybody.
Okay, with that, I think our time is up. So I want to thank Dr. Sherlita Amler, Dr. Nora Mazzone, and Matthew Anderson for being extraordinary panelists, and for delivering a great program. And once again, thank you, LMC Media, for helping us present it to the community.
I want to thank everyone too, and encourage everyone to come to our next program, the second Tuesday of April, where we will be talking about data privacy. Thank you again, all our outstanding panelists, and to all of you for attending. Thank you.
Thanks for
Thank you,
inviting
everyone.
us.
Thank you.
Stay safe, everyone.
Stay healthy.
Yes.
It's an order.